Live from ZTN studios in Harare, Zimbabwe, welcome to State of the Nation. I am Owen Kaura. Now today, Zimbabwe joins the rest of the world in commemorating International Day for Disaster Risk Reduction. Nothing undermines development like a disaster. We have learned from recent pandemics such as the COVID-19 and climate change, which have given us clear examples of universal risk and an illustration of the need to include people affected in the design of policies and plans to manage their risks. Indeed, careful planning around the location of critical infrastructure saves lives and avoids economic losses. Disaster risk reduction should be included explicitly in national development plans and climate adaptation plans, as well as budgets, of course. Now, the International Day for Disaster Risk Reduction was started in 1989 after a call by the United Nations General Assembly for a day to promote a global culture of risk awareness and disaster reduction. Held every 13 October, the day celebrates how people and communities around the world are reducing their exposure to disasters and raising awareness about the importance of reining in the risks that they actually face. Now let's just take a look at the Sendai Framework. Now, this was the Sendai Framework for Disaster Reduction 2015 to 2030, and it was the first major agreement of the post-2015 development agenda, and it provides member states with concrete actions to protect development gains from the risk of disaster with the 4 key priorities. And I'll just go through those priorities quickly. Priority number 1 is understanding disaster risk. Priority number 2, strengthening disaster risk governance to manage disaster risk. Priority number 3, investing in disaster risk reduction for resilience. And priority number 4 is enhancing disaster preparedness for effective response and to build back better in recovery, rehabilitation, and reconstruction. Now, this year's International Day for Disaster Risk Reduction comes at a time when the world is actually coping to the effects of impending crises such as climate change and, as I mentioned earlier on, the COVID-19 pandemic. Now, the commemorations, of course, also precede the COP26 to accelerate action towards the goals of the Paris Agreement. This discussion is brought to you by the Zimbabwe Resilience Building Fund, ZRBF, in partnership with the Department of Civil Protection, that is the Zimbabwe Department there. And the Zimbabwe Resilience Building Fund is a long-term development initiative funded by the European Union, Government of Sweden, Foreign Commonwealth and Development Office, that's the FCDO, and the United Nations Development Programme, that's the UNDP. Now, you may be asking, what is the overall objective? Well, the overall objective of contributing to increased capacities of communities to protect development gains in the face of recurrent shocks and stresses, enabling them to contribute to the economic development of Zimbabwe. And as the program goes on, you will notice that we actually do have members of the community from the grassroots level as well. Now, we're going to start with the opening remarks, the keynote address from the UNDP. And online, joining us online is Anne Madzara. She is the acting deputy resident representative of the United Nations Development Programme here in Zimbabwe. Anne, a very good morning to you and welcome to the program.
Good morning, Owen, and good morning, viewers.
Great. You may go ahead with the opening remarks, Anne.
Thank you so much. So, viewers, the Sendai 7 campaign is in its 6th year following its launch by the UN Secretary General in 2016. So each year has been dedicated to one of the 7 of the Sendai framework agreed by the United Nations member states at a World Conference on Disaster Risk Reduction in Sendai. The focus this year for this year's International Day for DRR is on Sendai Target 6, which focuses on substantially enhancing international cooperation to developing countries through adequate and sustainable support in order to complement their national actions for implementation of the present framework by 2030. Hence, the theme for this year is international cooperation for development countries to reduce their disaster risk and disaster losses. Viewers, this is important because planetary emergencies can only be adequately addressed through impartial and inclusive international cooperation on disaster risk management. International cooperation is essential that no vulnerable people are left behind in disaster-prone settings, including women, children, people with disability, the elderly, the migrants, and indigenous people. Commemoration of this day, viewers, comes as UNDP has finalized and received endorsement of its country program document, which will run between 2022 and 2026. This will provide a framework of support to the Zimbabwean government for the next 5 years. Under this planned support, disaster risk reduction is one of the key components whose delivery will be anchored on cooperation with other development partners and donors. UNDP is cognizant of the fact that disaster risk reduction is very critical in promoting resilience agenda, especially considering the changing climate. As such, through the Zimbabwe Resilience Building Fund, which is a multi-partner initiative funded by the EU, Sweden, UK, and UNDP, with strong collaboration and leadership of the Ministry of Lands, Agriculture, Water, Fisheries, and Rural Resettlement, UNDP is supporting DRR activities to build resilient communities, eradicate poverty, hunger, disaster risk reduction, and induced economic losses. Key to the work that the Zimbabwe Resilience Building Fund is doing is the cooperation of the international development partners that I have mentioned above, which delivers multi-layered capacity support to boost disaster resilience in the face of extreme events and other natural and man-made hazards. Recently, UNDP has supported the government of Zimbabwe to secure the Green Climate Fund for a climate resilience project in 15 districts and 3 provinces. This will also expand on the Zimbabwe Resilient Building Fund and will also expand the international cooperation effort around DRR and resilience building. Viewers, I think it is important to acknowledge that the differential impacts of disasters, particularly in terms of mortality, numbers of people injured, displaced and homeless, economic losses and damage to critical infrastructure are key to note. As such, the Zimbabwe Resilient Building Fund has supported the government in the development of a wide-ranging disaster risk management set of tools to enhance community resilience against various shocks, hazards through effective disaster planning. Effective disaster risk management planning in the 18 districts we are working is starting to bear fruits already, where there is evident reduction of disaster risk and disaster losses. This has been evidenced from our various outcome monitoring surveys that we have done 3 times already throughout the period, the life period of the Zimbabwe Resilience Building Fund. Noting, however, the need for international support for greater investment around multi-hazard early warning systems in Zimbabwe, UNDP therefore continues to mobilize both technical and financial support from the international community to be invested in disaster reduction initiatives. This will contribute to the reduction or mitigation of disasters in Zimbabwe. Viewers, today as we remind each other on the need for robust disaster risk reduction, we continue to encourage the sharing of best practices and examples of international cooperation and partnerships that have a positive impact on the lives of people who live in disaster-prone parts of the country. This will reduce the number of people affected by both natural hazards and man-made disasters and guard against loss of economic and resilience gains. UNDP will therefore continue to advocate for the enhancement of international cooperation support by strong national systems for disaster risk reduction, aid management and deployment in Zimbabwe, and also supporting the crowding in of more development funding, and will continue to complement the government of Zimbabwe's actions to achieve this and other targets under the Sendai framework. With these few remarks, Owen, I hand back to you. Thank you so much.
Well, thanks very much, Anne, for those opening remarks. They're outlining the work around disaster risk reduction in Zimbabwe and, of course, internationally as well. Like I said earlier before, we've got guests in the studio who are going to also help us understand issues around disaster risk reduction. And we have the Acting Director, Response and Coordination from the Department of Civil Protection, and that's Lamek Betera. Lamek, good morning and welcome to ZTN. Great. We also have a Decide Mabumbo with Disaster Risk Management Associate from ZRBF that was being mentioned by Ian earlier on the Welcome Decide.
Thank you, Owen, and good morning.
Good morning to you. All right. We also have Godwin Kudzota. Godwin is a project officer from CBM. Godwin, good morning.
Good morning, Owen. Thank you.
And like I said earlier, we also have people from within the communities, you and I. We have from Mutoko, Ward 8, and she is a community disaster risk champion. We have Agnes Machona, otherwise known as Amai Nigel.
Thank you so much. Good morning, viewers.
Good morning, Amai Nigel. And definitely we'll be having to talk about issues around disaster risk reduction in your area. But what we want to do, we want to start from a very simple place. And we want to start with you, Lamek, from the Civil Protection Department. Just give us a brief rundown of what your department does.
Thank you very much. Thank you, viewers. Thank you, ZRBF, for inviting us to this important forum. Civil Protection Department is a department under the Ministry of Local Government and Public Works. Its core responsibilities is to coordinate disaster risk management initiatives in the country. And to do that, we use our decentralized structures from national up to the village level. That's how we manage to coordinate disaster risk management initiatives in the country.
All right, very clear, and we'll also be interrogating some of these issues that you've raised in your opening remarks there. But before we do that, we're just going to come to you, Decide. You can also tell us briefly about the Zimbabwe Resilience Building Fund and the role of disaster risk reduction in promoting the resilience agenda.
Okay, thank you, Owen. Like has been mentioned before, the Zimbabwe Resilience Building Fund. It's a project that started in 2016, and we are funded by the Foreign and Commonwealth Development Office of the UK government, the European Union, SIDA from the Swedish government, and UNDP, as well as the Danish government. So we are working in 18 districts through our partners, the 7 consortia partners, and we are targeting about 1 million people currently on the program. And quite a number of activities have been initiated since the inception, and most of them are aimed at building resilience. But like what you have said, the issues of disaster risk reduction are so important. We train communities in collaboration with the Department of Civil Protection on disaster risk management issues, so that the communities are able to do participatory risk assessment, where they go about in their areas to look for areas where they think that the disasters can happen. They also reflect on their capacities, social vulnerability assessments, where they also look at the resources and the skills that they have to manage those disasters. So after that analysis, we then try to support the gaps that they identify so that they are able to deal with the disasters creatively at a local level. Thank you.
Just before I come to you, Godwin, you mentioned very critical issues, but are the communities understanding this from the work that you've done so far?
Okay, thank you. We are also using the Sendai framework, like what you have highlighted, and the first pillar on that framework is understanding disaster risk. So the first thing that we do is to carry out that reflection that I've talked about. We give them maps where they can actually draw the areas where they are staying, and give us an understanding of what they think about it, where they think that hazards exist. So you find that they will identify places such as maybe close to game parks, maybe unprotected water sources. They might also identify issues to do with livestock diseases, crop pests, and so forth. So once they start identifying these challenges, we then try to come up with solutions together with the communities. And then with time, they are showing that they now have the capacity to manage some of those challenges.
All right, thank you for outlining that. Now, coming to you, Godwin, maybe you can just tell us what CBM is all about. What does CBM stand for first?
Yes, thank you very much, Owen. CBM stands for Crescent Blind Mission. Crescent Blind Mission is an international organization. Our work together, with others, what we call important stakeholders internationally, we strive to make the world a better place for people with disabilities, where everyone is included and where people with disabilities enjoy their rights. So for us, we are saying, where is the person living with disabilities? How are they included in whatever development agendas we have globally? So even when we talk about disaster risk reduction, for CBM, we're asking the question, are we planning together? Are we implementing programs together? Are we not leaving someone behind? Are we not leaving persons with disabilities behind? For us, that becomes a very important question.
And why is that important? Not to leave certain constituencies behind, for example, people with disabilities. Why is that important?
You cannot plan for persons with disabilities. You don't plan for them. We plan together. So it means as we develop our plans, we develop together. We don't leave them behind. Anything that you do without persons with disabilities is not for them. And you may come up with solutions which don't work for them. So we are saying the development agenda from the start must and should include persons with disabilities together.
Interesting. We'll come back to that later on as well. But like I said earlier on, I really appreciate when the community is involved. And I'm very pleased that we've got a community member from Mutoko here. Now, Agnes, coming to you. In terms of the community, let's look at Mutoko. What is the role of the community in terms of disaster risk reduction?
Thank you so much, Mr. Owen. As the community, at first we have to list down our disasters. Then when we list them down, we give each one a duty to do. Some of the duties are given to the leaders and some of the duties are given to the individuals. Then if we know that we have a disaster, we have to deal with that disaster. For example, let me say soil erosion. We don't have to find someone who will do it for us. We have to do it on our own. Thank you.
It's interesting that you mention issues like soil erosion, but going back to the community, like I asked, yes, do they understand? And in terms of the language, which languages are you using? Are you using the local languages or are you using international languages? Do the people really understand?
Yes, this time people are now understanding due to some of the trainings mostly done by the ZRBF. People are now used to it. And most of the time we use our local languages to tell people.
All right, now Lamek, you've heard what they've all said, and you've also highlighted some of the roles that you play in terms of disaster risk reduction. But just coming to you, again, why is it important? Why is this important in terms of the Civil Protection Department? Why is this important? You know, we had the Cyclone Idai just a few years back, and we may say we were caught a bit unawares. Now, why is then this issue around disaster risk reduction important?
Thank you very much. As I said earlier on, I talked about coordination and I talked about the tender calls that constitute the disaster management architecture, which touches on the UN agencies, the NGOs, the communities. I'm happy the representation of the communities. Disasters will happen at a community. They are the first to respond. That's why you see the reason why we are doing CBDRM, community-based disaster risk management trainings at the community level, trying to capacitate them as they are the first responders. So it is very critical to talk about DRR. You know, a long way back we used to wait until disasters happen. NGOs used to come in the form of response, and even the government, a long way back, pre-independence, if I want to give an example, the Civil Defense Act, which was there, it was mainly looking at the white minority communities, the farmers, the soldiers who are injured. but coming closer to home with these other international frameworks that came in, that includes the Yogo framework for action, the Sendai framework within which we are. We opened up our minds to say we don't need to wait for disasters to happen. We change, there's a paradigm shift of looking at the risk itself. We want to address the risks so that we reduce damages to infrastructure. As Annie has highlighted, there has been an increase in these disasters related to climate change, and we are saying we need to try and reduce the risks. We want to reduce mortality rate, we want to reduce damages to infrastructure by way of building back better. I'm sure she highlighted talking about the other component of the Sendai framework where we are saying we need to build back better. It's not only in terms of infrastructure, it's also in terms of policies, strategies. You know, we learn from previous events. We learned a lot from Cyclone Idai, as you said. What did we learn? We learned that disasters, you know, when they come, we cannot compare them. Each disaster has got its own characteristics. Cyclone Elin in 2000, the way we managed it was different from the way we managed Cyclone Idai, and the impact itself was also different. So we learned from those previous disasters to build on policies and strategies for preventing or reducing or averting the impact of these disasters.
It's interesting that you mentioned that you're now looking more towards prevention, because the recent studies were showing that 20% of the emergency funds go towards a response. And it's good that you're now looking at efforts towards prevention. But let me just come to you, decide now, in terms of the ZRBF, Enhanced Community Disaster Preparedness and Effective Response, what ways are you using?
Okay, thank you. So what we are doing is we are working together with the civil protection structures at the sub-national level. So here I'm talking about the district and the rural district councils and also the ward councillors. So these are the ones who are coordinating the DRR structures at the sub-national level. So we first identify the gaps. Normally they do this contingency planning where they look at the disasters which are prevalent in that area, they look at their capacities, and then they identify the gaps. So what we have done, for example, we have provided fire beaters in some of the areas where we are working in the 18 districts so that they can be able to respond to any event of a fire outbreak. We've also provided IT equipment, working with the rural district councils. We have provided established information centers where early warning communication can be coordinated so that every time there's a pending disaster, information can actually reach the communities at risk. We've also provided bicycles to some of the disaster risk management committees so that they can coordinate response. And we've also provided even the trainings themselves, where they now have the capacity to respond, provided also with the first aid kits so that they can be able to respond efficiently, swiftly. So you find that in most of the areas that we are working, using their contingency plans, they are now better prepared actually to respond to any emerging hazards.
From what you're saying there, it seems your focus is mainly on rural communities. What are you doing for the urban communities? Because disaster can strike anyway.
Yep. Okay, thank you. So what happened is, even when we started the project in 2016, there was a national hazard mapping exercise that was done. So the 18 districts that were chosen are the ones which were ranked the top in terms of the number of hazards in those areas. These are the areas which are mostly in the marginal areas of the country. And so we find that that is where the need is the most. But also we are working together with the national structures such as the Department of Civil Protection to provide response and to plug in some of the gaps. We are also working on the policy issues, supporting the department as well, so that we also improve on disaster risk governance that can actually address both rural and urban disaster issues.
All right, great. Now coming to you, Godwin, of course you work with the vulnerable populations. You talked about people with disabilities, but then what are you doing to make sure that they're incorporated into all of this as CBM?
Thank you very much. For CBM, we have to collaborate. We have to collaborate with strategic stakeholders. We are here because we are collaborating with the CPU, Civil Protection Department. We are also, collaborating with this very technical fund. But it's not only collaboration about CBM. CBM, we believe that we have to work with organizations of people with disabilities. So organizations of persons with disabilities is a very strategic, constituents, because it represents the people with disabilities, with different types of disabilities. So as we come with CBM, we support the Federation to become critical, active stakeholders within the unit, within the government unit. So we are very pleased that we have managed as an organization to work and influence and support our PDs to collaborate with government. The moment we are in a position to do that, it means we are elevating the voice, amplifying the voice of persons with disabilities at policy level. So when they talk about policy formulation, when they talk about strategy, they are also asking, where is the voice of persons with disabilities? How are they represented in our policies? That is the discussion that we're having. And through organizations of persons with disabilities and persons with disabilities, we are influencing at that level. But this is at national level. But like he pointed out, there are structures which go down to the community level. And as CBM, we are promoting and supporting all PDs to be participating, to be engaged, to be influencing from the top to the bottom, from the bottom to the top. So that is our mandate, and that is what we're doing.
Naturally, you bring in the communities, so I'll come to you, Agnes. In terms of your response as a communities, give us examples of some of your responses to disaster risk reduction.
Okay, thank you. In Mtoko, we have done a lot of things. I'll start with the disaster of drought. In Mtoko, we receive less rainfall. So we have found strategies of how to harvest water. We have constructed demos through the program of cash transfer, which was being done by ZRBF. There are a lot of weir dams, and we are given trainings on how to harvest water. And then we go to the disaster of soil erosion. We were taught how to prevent soil erosion. We now plant trees. We now plant vetiver grass. As for now, we were given pockets to do tree nurseries. So by November, I'm sure we are going to plant more than 10,000 trees in Ward 8. And for the problem of, there were cattle diseases. It was caused by lack of dipping cattle. But now we are doing contributions to buy our own acaricides to make sure our cattle dip twice a month. And then we are now using non-timber forestry products. We are now utilizing them. So this helps most of the women to avoid gender-based violence. Most of the women used to get money from their husbands, but now most of the women now work on their own, harvesting, for example, Semenia Kafra, Mobola, Lipia Javanica, and many more. Even Arabi. So women are able to get their own man. And as for now, most of the people are making their own roads. They found that there are gullies in the roads, and they are filling those gullies. And we were given some trainings, for example, for the climate change. There's the introduction of Pfumvudza, and most of the farmers are now practicing the Pfumvudza concept. And we are growing small grains. Small grains have an advantage that they do not need a lot of rainfall. And even if you don't have some fertilizers, they can grow. And we are also practicing some ISOs. We have ISO groups. We use the ISOs for future problems. If you have a problem, it's easy for you to go and get money from the ISOs. So that's what we have done in our wards.
You've done quite a lot there, but one thing that caught my attention was the issue of gender roles. And I want to ask you that question. I'll come to you, Lamek, in terms of the work that you've been doing as the Civil Protection Department, in terms of the gender roles. Walk us through the gender dynamics in terms of disaster risk reduction.
No, thank you very much for that important question. What we have done is there are areas that we call cross-cutting issues. These include gender, people living with disabilities, the aged people. If you look at prior to the Sendai framework, there was this campaign which we called the Step Up campaign, where we were looking at each day, the 13th of October, we were looking at different themes or thematic areas, looking at those categories of people, women and children, people living with disabilities, the aged, others. We were looking at that. So we were designing programs during this important day, the 13th of October, where we could go either, depending on the theme of that year, we could go to old people's homes, where we bring them together, we talk, we also learn from the old people. For instance, we know the indigenous knowledge systems, they are best explained by the old people, so we could involve them. So the issues of gender, again, recently we have engaged a consultant to look at gender mainstreaming in disaster risk reduction. So that product is going to help us. We try to identify which areas, looking at the whole concept of disaster risk management, starting from, maybe if you want to start from mitigation, preparedness, response. We looked at to say, how are women involved? Are they being left out? But it's not only women, when you talk about gender, most people think about women. But we are saying, sometimes people think they are marginalized. So we are saying, how can we incorporate everyone? How can we not leave anyone behind in terms of disaster risk reduction? So we are really going towards that to ensure that everyone is included. And in support with the UN Women, they are there also. They are part of the system. As I said, civil protection is multi-sectoral. We are not operating in isolation. We use their knowledge. That's why we are saying we are involving almost everyone.
The department is not operating in isolation. Yeah. So I'll come to you from the ZRBF as well, DECIDE. In terms of the gender dynamics, I posed that question to Lamek, but from your perspective, he's given us his perspective, but your perspective.
Okay, thank you, Owen. So in terms of the approach that we use the community-based disaster risk management approach, where at ward and at village level, it's actually the different government departments that come together and plan around disasters with the involvement of traditional leadership and all the groups in the communities, including women and all the other marginalized groups. So using this approach, they also form subcommittees, like we have the gender action committees in most of the areas, which specifically focuses on issues of women, making sure that they are involved in disaster risk management issues at community level, at the lowest level. So we find that the participation of women has increased, and even in terms of the disaster risk action plans, the plans that they develop to tackle the hazards in those areas. For example, I can give of areas where there's issues to do with food insecurity, for example. They've managed to establish community gardens, and you find that the majority of the people working in those gardens are women, and they've also been involved in the various value chains in terms of developing the vegetables up until to the market. So they are quite involved, and this applies to so many other initiatives, such as the ISOs that she has talked about. These are saving groups where they are trained on how to save so that they can prepare for future shocks. Yeah.
All right, and now coming to you, Godwin, in terms of disability, disaster risk reduction, as well as gender, what is the nexus there?
Yes, I think the nexus is very embedded in the aspect of leaving no one behind. Because the moment we talk about inclusive communities, the moment we talk about inclusive disaster response mechanisms, we are not only talking about persons with disabilities. We are also talking about women. We are also talking about perhaps the aged. We are also talking about even people without anything who rely on others. So the aspect of inclusive communities, the aspect of inclusive response implies a lot in terms of inclusion. But you would also want to then connect to say persons with disabilities and the issue of gender. It also becomes another even unique aspect. For me, it then says they are more vulnerable. We know that in a disaster, persons with disabilities, they are 4 more times more vulnerable, even in a big disaster, to be able to access resources. So when you put the issues of gender dynamics, together with the issue of disability, you can see a compound of vulnerabilities, which begs the question that as we do our planning processes, we have to dig deeper into persons with disabilities, into issues of power dynamics, into all categories of vulnerability, so that our planning is informed by the felt needs of the person that we're working with. So basically, I will summarize and say the needs, the rights, the concerns of the most in need could be quite unique, and the probability of leaving them behind is high unless our planning processes are very deliberate before we intervene. So yes, there's a big nexus that should be interrogated further.
So indeed, we need deliberate planning processes. And then that brings in Agnes as well. We're talking about gender. Like what Lamek said earlier on, it's not just about men, women, no. But I need to ask this, in terms of the role that men in your community in Mutoko Ward 8, what are men doing in terms of disaster risk reduction? What is their role? Are they playing part?
Yeah, everyone is playing part. And most of the men are involved in doing some hard labor. If the labor is hard, men should go there. And if it's less, women should go there. And there's some point where, let's say there are meetings, we involve everyone. Women, men, and youth.
And also as women, you face unique situations, especially when disaster strikes. What are some of those issues that you face?
The main problem with women is that when there is a disaster, normally women look after children. And most of the time, when time is hard, the men run away. And the women are the only who are left behind with the kids.
All right, and then Anne, I hope you're still with us. You've heard what our panelists in the studio have been saying, and I would like to bring you in now, Anne. In terms of your assessment of the programs that you've initiated so far, what is your assessment, Anne?
Okay, thank you so much, Owen. In terms of the programs we have embarked so far, I think there's a lot more to do in terms of bringing in everyone around the table to discuss these issues and also to act. So UNDP has been focusing a lot on bringing in partnerships and engaging in different partners with different partners at different levels. So, and also engaging in community level planning. I think it has already been said that we need to put the voice and urgency of the communities that we serve in front. So it's very, very important so that we engage in participatory disaster planning with communities, with the right voices, with the right people on board at local level. And I also want to emphasize that the role of the local authorities is very important in supporting disaster risk reduction. So it's very important that we engage them from the word go as we do our planning. And I also wanted to emphasize that it is very important to continue at the highest level remember I said our support to DRR should be multi-layered. So I believe it is very important to, at the highest level, to have that coordination efforts strengthened, development aid coming into the country, also well coordinated with the Ministry of Finance coming in to appropriately manage and make sure that development aid is appropriately deployed to the right areas where disaster mitigation is required. So that's how I would say those are some of the issues we need to really take on board going forward. Thank you.
Thanks very much, Anne. Now, Anne brings in a very critical issue in terms of coordination, and that brings you in, Lamek. How is the government of Zimbabwe implementing the Sendai framework in line with the disaster risk reduction? She spoke about it earlier on, and you also spoke about it just a little bit earlier on as well.
No, thank you very much. As I said earlier on, that we don't operate in isolation. At the introduction of the Sendai framework, we brought together all stakeholders to say, here is this new concept coming from the Yogo framework, which ended in 2014. So we said we are taking up from the Yogo framework. There are issues that we had not addressed. Some of them we are taking them up to the Sendai framework, which is mainly data related. If you look at the Sendai framework targets, most of them they talk about more like outcome indicators to say how have you reduced mortality, how have you reduced the population displacements as a country. It's more like a tool to measure or to monitor the disaster trends and how we are working towards reducing them. So we are working together with all stakeholders. To mention ZRBF, there's this Sendai monitor where we need a lot of data, of which we didn't have before. We need databases in order to be able to implement fully the Sendai framework. I was happy we were talking about people with disabilities. We learned quite a lot from Cyclone Idai, where when we did our lessons learned seminar, where we also involved people with disabilities. They said, we are leaving us behind. We don't know, we were left behind. We could not navigate, running away from those rock boulders. The roads are not usable using the, what do we call it, the wheelchairs. So we quite learned a lot. So we said, we need a database. As of now, we don't have an appropriate database that disaggregates people with disabilities, probably by ward level, so that we'll be able to say in Ward 29 of Chimanimani, there are so many people with these kind of disabilities, so that we'll be able to assist them prior to the disaster happening. So there is quite a lot involved in the Sendai, and we also report to the international UNISDR, United Nations Strategy for Disaster Risk Reduction. We also report on our progress and our challenges that we are facing. So right now we are working towards bringing together stakeholders whom we think they have the databases of various kinds of destruction that happened since 2005, which is our baseline year. So we are doing that in order to be able to monitor the trends and see how we are fighting against these incidences together with all stakeholders. So that's what I can say briefly.
And I think that's very critical in terms of the database, because at the moment there is really nothing tangible in terms of the information. When you need it, it should be on the click of a button.
Yes.
But then we also have the COVID-19 pandemic.
Yes.
This has affected your work, and I believe everyone's work in here. We'll start with you, Lamek.
Yeah.
How has the COVID-19 pandemic impacted disaster risk reduction?
Yeah, really, this monster has really affected our work. As the government has diverted most of the resources towards responding to this pandemic. And you see that most of the programs that we had planned prior to March 2020, when the pandemic was declared, was declared pandemic in actual fact in March, around March 2020. So we had to reorganize ourselves to say, how can we deal with this? Is this a Ministry of Health issue? Is this so we realized that the pandemic was no longer a health issue. It was now everyone's business, whether infrastructure. We looked at infrastructure. We started diverting funds towards constructing isolation centers, quarantine centers. So instead of putting the funds towards the disaster risk, other disaster risk reduction initiatives, we had to divert it towards responding to COVID-19. As Minister of Local Government, we chair the Resource Mobilization Subcommittee, which tries to bring resources from government, from partners and development agencies, and even from the private sector. I'm sure you were hearing, it was coming loud and clear, all those things which were the donations in cash, in kind, and even in works, people would just say, no, we are not donating anything, but we want to rehabilitate this hospital. So there was quite a lot of attention towards the response. In fact, there is still, I'm speaking as if COVID is over, there is still a lot of attention towards addressing the COVID-19 pandemic. You know, sometimes when there is a new thing coming in, it would appear as if we are ignoring other disasters or other hazards, I mean, which are coming, like malaria. If you want to see the number of people dying maybe in Zimbabwe, you would think it's the COVID-19. But if you look at it closely, you could see there are other hazards that are, in fact, causing a lot of deaths, which we can compare with COVID-19. So, in short, there is really great attention towards responding to the COVID-19 pandemic.
And just as we round off the program, I'll come to you, Decide, in terms of the pandemic as well. Your work, how has it been impacted?
Okay, thank you, Owen. In terms of the COVID-19 pandemic, it has actually affected our work in terms of the communities that we work with. So what we have done is we have developed business continuity plans so that we can have a flexible working schedule to reduce the risk of infections. Then we've also developed contingency plans, which focuses on 3 areas, where the first one is on capacitating the communities in terms of providing them with equipment, health institutions, and so forth. Then we also have a risky communication strategy, which is aimed at providing more information about COVID risk, as well as ways of mitigating it. We're also doing a lot on water and sanitation, provision of potable water, so that we increase water for regular hand washing. But more broadly, it has affected communities because we are working mainly with the marginalized groups so that we build their capacity to adapt to shocks in terms of climate change. So in some cases, they could not access markets because of the lockdown regulations, and we had to devise strategies to ensure that there is continuity at the local level.
All right, and Godwin, how has it affected your constituency?
Thank you very much. CBM's work is broader. We are not only into disaster risk reduction, we are also working closely with the Ministry of Health, especially around eye health, where we support our various eye units to be in a position to provide eye health services. Apart from that, we are also working closely with the Ministry of Education for inclusive education. So when you look broadly at our work, we had to reflect, because of the pandemic, to adapt some of our strategies, to change some of our plans, to then be in a position to adapt to COVID-19. So yes, we had a moment to reflect and reorganize and be in a position to do our work within the pandemic. Thank you.
All right, and coming to you, Agnes, at a community level and the COVID-19 pandemic, how has it impacted your community, Ward 8, in terms of disaster risk reduction?
Thank you. Due to the COVID-19, it really affected the school children, and they have changed their norms. Right now, the school children, they are disrespectful just because they spent most of the time not going to school. They were just playing around in the forests, and a lot of crimes have risen up due to the COVID-19. And there's a lot of school dropouts. And we lost a lot of money due to the markets. As you know, we are farmers from Mtoko. We grew tomatoes, vegetables, and many more. So by the time they were ready, the market was closed. So it really affected us. And it also affected some of the women. You know, it was difficult for a woman to go to the clinic, especially to take the family planning methods. So they end up having unwanted pregnancies. It really affected us. Thank you.
All right, and I'm sure you heard what the guests in the studio are saying in terms of the COVID-19 pandemic vis-a-vis disaster risk reduction. Now, your take as we close the program, Anne.
Okay, thank you so much, Owen. I think COVID has really affected everyone, all sectors, and it has really given us an opportunity to sit back and think through how we deliver on development programming, and indeed on how we deliver on our attempts to manage and plan, manage disaster risk reduction and plan with other partners. Apart from COVID being a shock in itself, which needs its own planning and strategies to mitigate, I think it also gave us an opportunity to think through new solutions for building back better. For example, our work within UNDP, we've been supporting a number of government units to make sure that they are ready to work from home in the event of COVID-19. We are looking at the way we work in urban markets, where we are saying how can we make markets safer. Under our health program as well, we have repurposed funds for PPE. So COVID has really forced us also to diversify our programming areas, to repurpose funds, and also to reduce in some of our investments to focus on COVID. So this is quite a challenge, but also an opportunity for us to think through better solutions for delivering development programming for disaster risk management.
Thanks very much, Anne, and you have the final say on this very important discussion. And that's it on a State of the Nation today, a discussion around disaster risk reduction as we commemorate International Day for Disaster Risk Reduction. Many thanks to our panelists for joining us. Thank you very much.
Thank you. Thank you very much.
Great, and of course, thanks to you for joining in this discussion. Let's continue the conversation on our social media platforms. On Twitter, it's @ZTN News, and also on Facebook. Let's continue the conversations. I am Owen Kaura.